Good evening, ladies and gentlemen. This is the Truckers Podcast, FYI. I am your host, Doug from Ontario, Canada. It is 5 p.m. Eastern Standard Time here in Southern Ontario. Welcome to the show. It's a relatively cool day out there today. Certainly isn't normal September temperatures at this time of year, but that's going to change in the coming week. So anyways, had a really busy weekend. So I'm getting out here this evening because I know this coming week already, my work schedule, and that is going to be quite busy. Unfortunately, I didn't get a show in yesterday morning or this morning, so I'm doing a show this afternoon or into the dinner hour because this is about the time that I have right now. So thank you for joining me. So how bad is the addiction crisis in Canada? Because I spoke a little bit about this before and what the Ontario government's plan is to do with these safe injection sites in and around daycares, centers, and schools. 10 out, I think it was, 10 out of 19 are going to be closed by next March and transitioned into treatment facilities and detox centers. But these ones around these sites of these daycare kinder schools, are they going to have to move in order to have these in-treatment and detox centers? I don't know yet. Government hasn't said anything about that yet. They haven't really elaborated on really much about just, saying that, okay, we're going to inject $378 million into the addiction crisis and supports for people who have an addiction. More is to come on that. But how bad is the addiction crisis here in Canada? Right? The addiction crisis in Canada is indeed severe and has been described as one of the most serious public health crises in the country's history. In the opioid crisis since 2016, more than 38,500 people have died from apparent opiate toxicity. And the crisis is largely driven by the synthetic opioids like fentanyl. And of course, this has a widespread impact, and no community has been left untouched by this crisis. It's not a big inner city problem. It also is a rural problem, a rural area problem, all across Canada. Right? No community has been untouched by this crisis, affecting people who use substances, their families, and communities across the country. The toxic drug supply, the illegal drug supply in Canada is increasingly toxic and unpredictable, contributing to the high number of overdose deaths. The government and various organizations are working to address this crisis. So the Ontario government, like I said, closing 10 of these 19 sites, spending $378 million to transition these sites, if they're still going to remain where they are, around, within daycares, around daycare centers and schools, or do these centers now have to find a new location to be an in-treatment, and also are they going to have an out-treatment? that we're going to have to wait and see of what's going to take place. So, to working to address these crises, but it remains a significant challenge. We're talking about, again, where are they going to move these sites? So, how is Canada addressing this? So, Canada is taking a multifaceted approach to address this addiction crisis, particularly the opiate crisis. Canadian Drug and Substance Strategy. This is the federal government's comprehensive response to substance use related harms in the overdose crisis. It covers a broad range of substances, including opiates, and focus on public health and safety, as long as so is the Ontario government. Thank you for joining me. I am your host, Doug from Ontario, Canada. Like I said earlier when I came on here, I had just a crazy busy weekend. So, like I said, I didn't get a show in yesterday morning like I generally do, and this morning like I generally do, and my day is winding down now here Sunday. So I'm getting out to do this show and talk about how bad is the addiction crisis in Canada and what is the government plan to do about it. And this at the federal government's level with this comprehensive response to substance use related harms in the overdose crisis. So is the province of Ontario where I reside. You know, Doug Ford, the Premier of Ontario, his health minister, have decided that they're going to close 10 of the 19 safe injection sites because of their locations. And they want to, so the remaining 9, so they want to close them by March. So the remaining 9, because they're not in the vicinity of child care centers and schools, they will also have to change over to treatment centers, detox centers. Same with the other 10, but are they going to move these other 10 away from these daycare center areas and schools, find another location for treatment centers and detox centers? Because there's going to be, here in Ontario, there's going to be no more safe injection sites. There's going to be no more needle exchange programs by next March. That's not that far away. And now they're doing this now. Now, before you came on here, since 2016, this is 2024, so last 8 years, right across the spectrum, right across Canada, there has been 38,500 overdoses since 2016. The epicenter of the overdose is Vancouver, the Lower East Side. Back in, I think it was 2014, it could be between 2012, 2014, the Vancouver Police Services and the officers went out onto the streets, the Lower East End, filming the homelessness situation and the rampant drug use in the Lower East End of Vancouver. It was called Through a Blue Lens. Now, I haven't checked lately on YouTube if that video is still there. potentially it is. But you got to remember that was like 2012, 2014. Just raise awareness of the situation that had unfolded in the Lower East of Vancouver. But 38,500 deaths across Canada since 2016. Since 2016. Of course, the government is talking about harm reduction. So the government supports harm reduction measures. The last 5 years here in the province of Ontario, the Ford government supported the harm reductions by allowing supervised consumption sites. And they also allowed the locations where some of these supervised consumption sites were located within 200 to 300 meters of daycare centers and schools. They allowed them to be there. And even the one that we have here in the city that I reside in, there was, lots of controversy, to where its location, not that it was around any schools or daycare centers, it was around businesses. Then, of course, businesses get in an uproar, saying, no, we don't want it here. And we get into that not in my backyard syndrome. So these injection sites that, the 10 of them across Ontario that are in the vicinity of daycare centers and schools, when they transform over to treatment centers and detox centers, are they going to move those locations? Government hasn't stipulated on that. So the government supports harm reduction measures, such as supervised consumption sites, which provide a safe environment for people to use drugs under medical supervision. They also focus on treatment and recovery. That's how we come to this conclusion, or this point of where treatment comes into effect, that closing these 10 supervised consumption sites. Into treatment and recovery, investments are being made in addiction treatment and recovery service to help those affected by substance use disorders. These safe injection sites also help these people get into treatment. Working on public education and awareness, efforts are being made to educate the public about the risk of substance use and the importance of seeking help. Also, the government is investing in research and data collection to better understand the crisis and start to develop effective interventions. But these are just a part of a broader strategy to reduce the harms associated with substance use and support those affected by addiction. Now, will treatment centers and detox centers stop the addiction crisis in Canada? So treatment centers and detox centers are crucial components in addressing the addiction crisis in Canada. But they are not a standalone solution. And by saying that, we still need to have safe injection sites. So addressing the addiction crisis requires a multifaceted approach that includes prevention and harm, Measures like supervised consumption sites and needle exchange programs can help the immediate risk associated with substance use. Raising awareness about the risk of substance use and the importance of seeking help is essential. Ongoing support services, including mental health care and social services, are necessary to help individuals maintain long-term recovery. So while these treatment and detox centers play a vital role in helping individuals overcome addiction, the crisis is complex and requires coordinated efforts across various sectors, across all sectors of the healthcare system. So what types of treatment do we already have and what are available in Canada? Canada offers a variety of treatment options for addiction, and they're tailored to meet the diverse needs of individuals. Detox. This is often the first step in treatment where individuals undergo medical supervision to safely withdraw from the substance. Inpatient rehabilitation. There are live-in facilities where individuals receive intensive care treatment and support in a structured environment. These safe and section sites, ladies and gentlemen, help these individuals who want help, we get them into detox, and they help them get into these facilities that are available here in Canada. Oh, my dog's barking. You can probably hear that. That's just fantastic. And he's going to go ballistic until his owner comes in the house. But anyways, can't do anything about it. Outpatient programs. These programs allow individuals to receive treatment while living at home, making it easier to maintain daily responsibilities. See, this dog is nuts. Believe me. He's just a little guy too. His bark is bigger than him. So sorry about that. So outpatient programs, like I said, these programs allow individuals to receive treatment while living at home, making it easier to maintain daily responsibilities. And so for the outpatient programs, I mean, it's, probably for, people who, um, I guess it would be like the level of mental drugs people take every single day, right? They don't have to be injecting it. They don't have to be snorting it. They can just be popping it. Painkillers, for an example. We get addicted to painkillers. Counseling and therapy. These include individual, group, and family therapy to address the psychological aspects of the addiction. We also have the medication assisted treatment, also known as MAT. This involves the use of medications in combination with counseling and behavioral therapies to treat substance use disorders. Harm reduction services. And again, what does it bring back up? This includes supervised consumption sites and needle exchange programs to reduce the risk of associated with substance use. They also have support groups, mutual aid groups like AA and Narcotics Anonymous, provide peer support and a sense of community. Also have the rapid access addiction medicine, also known as RAM. These walk-in clinics provide immediate access to addiction treatment and support. These treatment options are designed to provide comprehensive care and support to individuals struggling with addiction, in which these safe injection sites help direct these people to these services. if, for instance, they want the treatment. So the government wants to close these 10 um, safe injection sites. The closure of safe consumption sites in Ontario has raised significant concerns among public health experts and advocates. The impact on overdose deaths. Studies have shown that supervised consumption sites can significantly reduce overdose deaths. For example, a recent study found that 67% a reduction in overdose deaths in Toronto neighborhoods within 5 meters of these sites, within 500 meters of these sites. 60% reduction in the overdose deaths in the city of Toronto. The most populated city here in Ontario. See, Doug Ford and his healthcare minister doesn't think these safe consumption sites are working. Public health concerns, the closure of these sites may lead to increased public drug consumption, greater strain on the first responders and the emergency rooms, and potentially more overdose deaths. And these people, are sounding the alarm. Harm reduction services. So by closing these 10 sites, of being in the proximity where they are, and the harm reduction services, safe consumption sites provide a safe and a judgment-free space for people to use substances under medical supervision, which can reduce the risk associated with substance use. And you'll see how many times this comes up. Community safety, while there are divided opinions on the connection between consumption sites and a rise of crime, data suggests that these sites can reduce illness and death from overdoses. So the decision to close these sites is controversial and has sparked debate about the best approach to harm reduction and public safety. So what are the arguments for and against the safe consumption sites? The safe consumption sites, also known as supervised injection sites, have both supporters and critics. Arguments for safe consumption sites: harm reduction. These sites provide a safe environment for people to use drugs under medical supervision. And you can turn blue in the face and tell that to Doug Ford, the Premier of Ontario, and his health minister. And they'll just put their fingers in their ears so they can't hear you. Reducing risk of overdose and the spread of infection diseases. And this is where the needle exchange programs come in as well. I watched a video one day last week on YouTube, and it was in the city of Timmins, Ontario, which is about 10 hours north from where I reside. It's a small community. I know this because I've been there plenty of times. The council person, it was about closing the only safe injection site they have there. They want it closed. It's around businesses. So he's walking. So the council person is walking around with person from the news media, and showing alleyways. They'll say this is where people shoot up, this is where people shoot up, whatever the case may be. People go to the safe consumption site. It's not, the safe consumption sites are not open 24/7. So, people who are using these substances and shooting up, it's not like, oh, okay, it closes at 9 o'clock. I'm going to be good till 6 o'clock in the morning. I'm just going to go home and sleep. No, that's not going to happen. You know that. I know that. They need to get their fix. So in the middle of the night, they're going to use these alleyways. So they were talking to a couple people who were standing around there waiting to get in because they only had 3 tables available with chairs and their staff on site. So they have to wait. And they were talking about why you shouldn't do this. Why shouldn't you close this? And they're saying, we would potentially die. We would overdose. And it provides safe needle exchange. And the reporter standing there with the councilman asks this young lady, says, how many needles can you get? She goes, I can walk in there, I can get 100 needles. And the council person says, no, you can't get 100 needles from there. So she walked in there and she came out with a box of 100 needles. At the end of the day, a couple days later, last week, a news article pops up. Timmins closed that safe injection site. Now they bought a vacant hotel, and they're asking the province of Ontario for some of that $378 million. They were not getting any money from the province to run that safe injection site. It was ran by the city of Timmins. So they jumped the gun. They closed this site. That's ridiculous. Now, these safe injection sites, these sites often connect users with other health and social services, including addiction treatment and mental health support. Crime reduction research has shown the safe consumption sites can lead to a decline in drug-related crime in the surrounding area. Not according to the province of Ontario, not according to Doug Ford and the health minister. They're claiming the opposite with absolutely no proof to back it up. Arguments against safe consumption sites, normalization of drug use. Critics argue that these sites may normalize or even encourage drug use by providing a safe space for it. No, I don't think so. It's not encouraging anyone. These people have an addiction. This isn't making them want to use drugs more, or more people use drugs. They have an addiction already. The community concerns that about the impact of neighborhoods, particularly of these sites located near schools or daycare centers. Legal and moral issues. Some believe that these sites conflict with federal drug laws and raise moral questions about enabling drug use. The federal government had already turned around, and people who use drugs So the quantity that you can have on you, personal use. You don't have 50 little baggies in your pocket and a ton of cash in the other one. You'd be busted for dealing. So they reduce the amount that you can have for personal use without being arrested and charged. The effectiveness, opponents argue that safe consumption sites do not provide enough incentive for users to seek treatment and stop using drugs. Well, you can lead a horse to water, but you can't make it drink. It's entirely up to the individuals who are using these illicit drugs if they want treatment or not. The debate over safe consumption sites is complex with valid points on both sides. I don't know about the other side. The effectiveness of these sites often depends on how they are implemented and integrated into a broader public health strategies. So these 10 consumption sites, they have until next March to transform into treatment centers and detox centers, not used to be taking drugs or safe needle exchange programs. Try to estimate the exact number of drug users who accept help obviously is challenging, as it is depends on various factors such as the availability of services, individual readiness, right? Not everybody's going to be ready. They'll be ready for change and social supports. However, some data can provide a rough idea. So, according to the Canadian Alcohol and Drug Survey, about 21% of Canadians will experience substance use disorder in their lifetime. Among these who use substances, a significant portion may seek help. For example, a study found that 30% of Canadians who reported past year stimulant use also reported problematic use, indicating a potential need for treatment. Now, whether they accept the treatment or not, that's see what happens, I guess. And while these numbers are given in a general sense, the actual percentage of drug users who will accept help can vary widely. Efforts to increase access to treatment and reduce stigma around seeking help are crucial in encouraging more individuals to seek the support that they need. So we need to, stop the stigma of addiction. The barriers that can prevent individuals from seeking help for substance use, stigma and discrimination. Fear of being judged or discriminated against can deter people from seeking help. Lack of awareness. Some individual may not recognize that they have a substance use problem or may not be aware of the available treatment options. And the cost and the accessibility, the cost of treatment and lack of health care coverage can be a significant barrier. Here in Ontario, we have the Ontario OHIP insurance plan. Everybody here in Ontario is on that plan. They don't pay out of pocket for anything. But when it comes to um, the treatment and the lack of health care, well, just put it the lack of health care. I mean, you know, we're dealing with hallway health care in our hospitals because we don't have enough beds. And their fear of legal consequences, concerns about legal um, repercussions, such as losing custody of children or facing criminal charges, could prevent people from seeking help. It also has a social and family impact. Worries about the impact on family relationships and social standing can also be a deterrent. Time constraints, some individual may feel they do not have the time to commit to treatment due to work or family responsibilities. Now, could be talking about even different substance uses, such as popping painkillers all the time. The ones really what the government is talking about, and we're not excluding the people who have addictions to other illicit drugs, people who are injecting every single day. And the risk of fentanyl being in that mix. 3 tiny grains of fentanyl can kill you. Fentanyl is 100 times more potent than morphine. Previous negative experience, past negative experience with treatment or healthcare providers can discourage individuals from seeking help. Maybe the way they've been treated, during their experience by the healthcare professionals. Are there any successful strategies for reaching the underserved population? There are several successful strategies for reaching the underserved population in addiction treatment. Community-based interventions. These involve working directly with communities to provide accessible and culturally sensitive care. This can include mobile clinics, community health workers, and local outreach programs. For the cultural sensitive and inclusive care, providing care that respects and incorporates the cultural backgrounds and experience of individuals can help build trust and improve engagements from whatever walks of life you're from. Trauma-informed care, recognizing and addressing the impact of trauma on individuals' lives is crucial. Trauma-informed care ensures that services are provided in a way that is sensitive to the experience of those who have faced trauma. And the leveraging touch points, utilizing encounters in emergency departments and inpatient hospital settings as opportunities to initiate treatment and link individuals with outgoing services in the community. Advocacy and policy support, supporting legislation and policies that improve access to quality addiction treatment. Now, by them saying this, right? I support these safe injection sites. But I also support that they have access to the addiction treatment that they need and that they're going to get. But even, going back, so we got 19 safe injection sites here in Ontario, closing 10 of them, and so because of their locations, and the 9 still are still are going to be able to operate, but they're not going to be able to operate as safe injection sites after March. They're going to have to transform into treatment and detox. Public education and awareness, raising awareness about the availability of services and reducing stigma around seeking help can encourage more individuals to access treatment. So these strategies aim to address the unique challenges faced by underserved populations and ensure they receive the support that they need. So when it comes to the rural communities, all the places outside of major cities, communities in accessing treatment, are there specific challenges in these areas, in these communities? They face several unique challenges in accessing addiction treatment. The other problem that we're facing in these rural communities, emergency departments are closing, or they're only open so many hours per day and closed in the evening. We're facing this here right now, here in Ontario. See, the Ford government, Doug Ford, he has this obsession with alcohol. He thinks that all Ontarians want better access, more accessibility to alcohol than getting it at the liquor stores and the beer stores. So he comes up with this plan. Now you can buy alcohol in every corner convenience store. This was a priority for him. Never mind these closures of these hospitals, emergency departments, and communities outside larger cities. He was bound and bent that he was going to get this done at a cost on the taxpayers' backs of about $2 billion. Now, where do you think that money could have been well spent? In our hospitals, doctors and nurses, other services, addiction. No, not Doug Ford. Shortage of healthcare professionals. So these rural areas often experience a chronic shortage of healthcare providers, including addiction specialists. This can lead to long wait times and limited access to care. Stigma and privacy concerns. Higher levels of stigma and privacy concerns in small, closed-knit communities can deter individuals from seeking help because, small communities, everybody knows everybody's business. The people may fear judgment of having their confidentiality breached. Limited resources. So these communities may have fewer resources support services available, such as counseling support groups and harm reduction programs. When it comes to the digital access to the internet, while the telehealth services can have expanded, there is still a digital divide in these rural areas with limited access to high-speed internet and technology. This can hinder the effectiveness of virtual care options. Economic factors, economic challenges, including lower income levels and higher rates of unemployment can make it difficult for individuals to afford treatment. Well, you're not going to have to worry about that here in Ontario because Doug Ford, $378 million they're implementing into treatment and detox. I don't know if this is just a one-time injection. This is going to be a yearly thing. How much is it going to cost every single year? To me, it doesn't matter if we can get people into treatment and we get people into treatment. But we're not going to solve the addiction. We're not going to solve the addiction problem. These illicit drugs on our streets are going nowhere. So, so when it comes to the telehealth in these areas, can significantly enhance access to health care, expand the broadband access. Investing in broadband infrastructure is critical to ensure reliable internet connectivity, which is essential to telehealth services. Increase awareness and training, educating both healthcare providers and patients about the benefits and use of telehealth can improve adoption rates. Leverage mobile health clinics. These mobile clinics equipped with telehealth technology can reach remote areas, providing essential healthcare services. Focus on specialty services for the telehealth can be particularly effective by providing access to specifically services that may not be available locally, such as mental health care and chronic disease management. So, you know, for the healthcare professionals that are sounding the alarm, they're asking, what does the Ontario government not understand about the safe injection sites? So the Ontario government's decision to close safe injection sites near schools and daycare centers has sparked significant debate. Public health benefits. Safe injection sites have been shown to reduce overdose deaths and the spread of infection diseases. They provide a controlled environment where individuals can use substance under medical supervision, and they can prevent fatal overdoses. Community safety. Contrary to concerns about increased crime, studies have shown that these sites can actually reduce public drug use and the number of discarded needles in public spaces. And access to services. These sites offer and often serve as entry points for individuals to access other healthcare and social services, including addiction treatment and mental health support. And what the experts or recommendations are, the decision to close these sites goes against the recommendations from two government commission reports, which suggest keeping existing sites open and increasing funding to stabilize staffing. And of course, stigma comes back into this again. And the barriers. Closing these sites may increase stigma and barriers for accessing care and making it harder for individuals to seek help and support. Because once these places are closed and they're integrated into treatment centers and detox centers, you can't. It's really hard to put a number on it because how many people, you know, how many people have an addiction in Canada? The population of Canada is 40 million people. We can't put a number of how many people are going to access these services. So the debate over safe injection sites is complex. And while the government's concerns about community impact are valid, well, I don't know if it's really valid, many public health experts believe that the benefits of these sites outweigh the potential drawbacks. So, has crime and violence increased around the safe injection sites? Research on the impact of safe injection sites on crime and violence has shown mixed results, but many studies indicate that these sites do not lead to increase in crime. No significant increase in crime, and you can tell this to the health minister and Doug Ford until you turn blue in the face. A study of safe injection sites found no statistically significant increase in crime or disorder in the vicinity of these sites. The public health benefits of the safe injection sites have been associated with reduced public drug use and fewer discarded needles in the public spaces. Quality of life complaints, while there was no significant increase in crime, some studies have noted an increase in quality of life complaints such as concerns about public safety and cleanliness. I mean, they've really cleaned up, these areas too, because having the needle exchange programs and the safe injection sites. Yes, there are people who are users. Yes, there are people who don't go in there and use these safe injection sites. And yes, they're still going to find some discarded needles. I get that. Overall, the evidence suggests that safe injection sites do not contribute to an increase in crime and can provide significant public health benefits. How do safe injection sites impact nearby communities? Reduction in overdose deaths. These are the positive impacts. These sites provide a safe environment for the drug use. Improve public health. Decrease public drug use. Access to services. The community perception. Some community members worry about the potential for increased foot traffic and the perception of their neighborhoods as drug hotspots. Quality of life complaints. While crime rates may not increase, there can be an increase in quality of life complaints, such as concerns about public safety and cleanliness. Overall, the evidence suggests that safe injection sites provide a significant public health benefits without leading to an increased crime. By addressing the community concerns and perceptions is crucial for the successful um, usage of these sites. By closing these sites, is there a potential risk of overdose? Increased overdose deaths, safe injection sites. Again, how many times does this keep coming up that provide that controlled environment where they can use drugs under medical supervision? Helps prevent fatal overdoses. Without these sites, the risk of overdose deaths are going to increase. The public health concerns. These sites help reduce the spread of infection diseases such as HIV and hepatitis C by providing clean needles. And just like I said earlier, that young lady who walks into that safe injection site in Timmins, Ontario, because the council person didn't believe that she can go in there and get 100 needles, so she goes in there. She comes out with a box of 100 needles. safe injection sites. So and this it helps with discarding needles in public spaces. And of course, the access to services. These sites often serve as an entry point for individuals to access other health and social services if they want it, including addiction treatment and mental health support. Closing them could reduce access to these critical services. So while the intention behind closing these sites may be to address community concerns, the evidence suggests that the benefits of safe injection sites in terms of public health and safety outweigh the potential drawbacks. So the population of drug users in Canada, I mean, it's really hard to put a number on it, but 2019, approximately 17.5% of Canadians reported having used an illegal drug at some point in their lifetime. This includes a range of substances such as hallucination drugs, cocaine, crack, and ecstasy. So, what about the age groups? Are there any specific age groups more affected by substance abuse? Age groups are more affected by substance use in Canada, and here are some key points. Young adults age 15 to 24. This age group is particularly affected by substance use disorders, according to the Canadian Mental Health Association. Young people aged 15 to 24 are more likely to experience substance use disorders than any other age group. Adults 25 to 44, substance use is also prevalent among adults aged 25 to 44. This group often faces stressors related to work, family, and social responsibilities. Older adults 45 plus, while less affected than the younger age groups, substance use disorders can still be significant among older adults. So, understanding these specific needs and challenges of each age group is crucial for developing effective prevention and treatment strategies. We have a long way to go, an awful long way to go. Now, I've had people, see it didn't connect, but that's okay. The call-ins um, are on, and it shows call-ins. Trying to connect here with you. For some reason, it's not connecting. Well, I'm sorry about that, because the call-ins are activated. Let's try this again. She's trying hard. I'm trying hard on my end to connect. Doesn't sound like it wants to connect. I don't know if you could just tap on the round circle. Obviously, that's what you're doing. But it's not allowing me to connect to you. I don't get this. I had that same problem the other day, too. I was kind of nearing the end of my show and someone was calling in and then it wasn't for some reason, it's not connecting. I could try turning them on and off, and then we can try it again. Now they're back on. I don't understand why that's not working. I really don't. Allow call-ins is on. I see your profile here. I see your profile to my left, but it's not allowing me call in. I'm going to have to talk to Podbean about that because I've never had the problem before. Well, in the meantime, Lacey86, I hope you come back on my show. We can try this again. Time to time, I talk about this. And this topic is going to be around for a while. Until they can figure this out. I have no idea why that's not working. This is ridiculous that she can't call in here. That's ridiculous. I apologize. I apologize for that. But it is coming to the. It is coming for the. Thanks for the likes of 10 hearts. I appreciate that. But I got to contact customer service at Podbean and figure out why it this happened the other last weekend too, that someone tried to call in and it didn't connect. So I apologize for that. I will get that problem straightened out. So until my next show is probably going to be next weekend. Like I said before, I have tried weekday during the week in the evenings to come on the show. I was going to set up shows Monday, Wednesdays, and Fridays, and that didn't go off too well. It really didn't. That was before my summer vacation. That was before August. It didn't work. Thursday seemed to be my lighter day. But that's kind of up in the air. It kind of changes a little bit. And because I do work long days, I work long hours. And one thing I don't want to do is feeling fatigued doing a show and losing, concentration on the topic that I want to discuss. So that's why it's hard to do that. I work 12 to 14 hours a day. Thursdays seem to be my lighter days. Saturday morning, Sunday mornings. This weekend was just out of control. Just busy. So I didn't get my morning show off yesterday. I didn't get my morning show off this morning. So I did an evening one because it is Sunday, starting at 5:00. So I got a show in, and I'm happy about that. I'm glad you're here. I'm glad you came and enjoying the show. And I usually say this from time to time too, is that, you, the listeners, are the podcast. And by saying that, without you, there'd be no podcast. That's how important you are. I'm the host, and I try to bring you informative information that you may already know or may not know, which is fine. It's for your information. I learn from it as well. So for now, my next show is going to be Saturday morning at 8:30 a.m. Eastern Standard Time, because I am from Ontario, Canada, and that's the time zone that we're in. And of course, I think it's like really early November. The time change, daylight savings time. I don't even know why we're still using it, but we are. But we're on Eastern Standard Time here in Ontario. So Saturday, 8:30 a.m. Eastern Standard Time, the show will be back out. And I'll post that show up as we get closer to the weekend. Hopefully Thursday I can come out and do a show. I won't know probably until about Tuesday, Wednesday morning, if it's going to be feasible to do a Thursday evening show. So we'll find out. If it is, if you're following me, if there is one posted up for Thursday, then you'll know about it. So until then, ladies and gentlemen, enjoy the rest of your Sunday, of your weekend. Enjoy your upcoming week. And be safe out there. This is the Truckers Podcast, FYI. I'm your host, Doug, from Ontario, Canada. Take care, and thank you.